Good afternoon and welcome to the weekly update from the Department of Behavioral Health. July is Black and Indigenous People of Color Mental Health Month, and hopefully you've seen the video that our Public Behavioral Health Department put out. I highly encourage you to watch it if you haven't already viewed it. On to COVID. In terms of world numbers, we hit a grim milestone this week with 4 million deaths from COVID. We're at 185,291,000 cases of COVID, and now just over 4 million deaths from COVID across the world. In the United States, we continue to march on. We're at 606,376 deaths. In California, we are seeing a slight upward trend in our positivity rate. I'll report out a similar trend for Fresno. Last week we were at 1.4%, and remember, we really want to stay around that 1% in order not to spread COVID more, and so going above 2, not good for us. In terms of Fresno County, I do want to mention that we had some of our positive COVID cases in the case count were removed. There was an error that they discovered, a little under 700 cases. So you'll actually see a lower case count this week than last week, but a slight increase in our deaths. So there was no change to the death count, just to the case count. Hospitalization, we're at 43 today, or through yesterday, with 8 in the ICU. That number has hovered in the high 30s to mid 40s for several weeks now, but our positivity rate actually has went up. So on this next slide, what you'll see is our testing information. We have performed over 1.3 million tests in Fresno County and have a 2.4% test positivity rate right now. So you'll see on the lower right, I put a red arrow to show you that slight increase in positivity that we're seeing just in the last couple of weeks. We do know that the Delta variant is here, and it's the predominant variant in the United States. It's becoming the predominant variant in California and in Fresno County. So we do anticipate seeing increased cases of COVID. We have now administered over 900,000 doses of vaccine, 901,675. We have just under 395,000 people fully vaccinated and another 72,245 who've received at least one dose of a 2-dose vaccine. That reflects about 44.8% of our population overall is vaccinated or has had at least one dose, and 54.4% of those 12 and older. So while our cases continue to be trended down, hospitalizations being stabilized, we are seeing our positivity rate increasing, and that is something that we'll need to watch very, very closely. In California, I do want to mention that information came out that between January 1st and June 30th of this calendar year, out of approximately 20 million vaccinated individuals, 8,699 of those vaccinated got COVID, had a positive COVID test. 652 of those were hospitalized, and 71 individuals who were vaccinated out of 20 million people died. During the same time frame, representing unvaccinated folks, there were over 36,000 deaths. I'm sharing this with you because I'm truly gravely concerned about our low vaccination rates and what that will mean for those of you who are unvaccinated. This statistic alone should be alarming to you, that 71 vaccinated people died in a time frame that 36,000 other people died who were not vaccinated. And nationally, we're seeing very similar information. In June, Maryland had 130 COVID deaths, all in unvaccinated people. There were no COVID deaths of vaccinated individuals in Maryland. And 95% of their new cases were in unvaccinated population, and 93% of hospitalizations were in unvaccinated individuals. We are still seeing hot spots. A COVID surge team was sent to Missouri this week. We had a COVID surge team when we were in the throes of our last surge. So definitely a sign that things are not good, and this is in, I believe, southeast Missouri. So I did want to share this other graph with you. This graph compares daily deaths per million compared to the vaccination rate. So the bottom of the graph, what we typically call our x-axis, shows the percentage of the population vaccinated with at least one shot. I've highlighted Fresno County for you because we are in between 40 and 50% vaccinated, and you can see that those parts of our country that have the lowest vaccination rates are clearly experiencing the highest death rates. So this is a fact. This isn't an opinion, this isn't misinformation, this is a fact. People who are unvaccinated are dying of COVID at higher rates. And in areas of the country where we have higher unvaccinated populations, like Fresno County, we might see double or more deaths per day due to COVID. These are facts. So I really, I asked last week if people could share questions or comments with me. I got zero, none, nada. So I thought I would share with you things I've heard and read about in terms of why people are choosing not to be vaccinated. A lot of people just don't trust the government or vaccine makers. They feel that the government's not to be trusted, that vaccine makers are motivated for the wrong reasons. Another reason that the vaccine was developed too fast and not all safety precautions were taken. I did cover this in one of my updates some time ago, so I'm going to briefly review for you again. When vaccines are developed historically, and we have a long, long history in the United States of developing vaccines, well over 5, 6, 7 decades or more, going back to things like the polio vaccine and such. I'm a part of the baby boomer population that I've had colleagues that I worked with, a little older than me, who had actually had polio and suffered the consequences of it. I have family members who acquired polio when they were young and lived with the consequences of having polio. And so the polio vaccine is in my lifetime, but when I was very, very young, we started getting the polio vaccine. So historically, it can take as long as 5 or 10 years or more to test vaccines. But remember, those are in situations where the virus itself is not occurring at a high enough rate to be able to compare that vaccinated and unvaccinated population. So in order to do a proper vaccine trial, you have to have a relatively equal population who gets the vaccine to compare to those who don't get the vaccine. And then you follow them over time to see who actually gets COVID, and does the vaccinated group get it at a lower rate than the unvaccinated group. And when the incidence of that virus is relatively low in the population, maybe it's not as transmissible, it hasn't spread everywhere like we experienced with COVID, it can take a long time for the virus to occur in enough people that you can statistically, scientifically say that one population is different than the other. So the vaccine worked or it didn't work. If the populations are the same, if they get the virus at the same rate, the vaccine didn't work. With COVID, because we have such a high prevalence, they were able to achieve those numbers much, much more quickly. And then the other thing, particularly with the mRNA vaccines and the viral vector vaccines, those are technologies for vaccines that have been in scientific development for some time. While the mRNA vaccines are newer, they didn't just figure out mRNA vaccines with COVID, these were things they were already working on in coronaviruses to try and come up with a vaccine, because this isn't the first coronavirus we've had. Colds are a coronavirus. We had SARS and MERS, if you'll recall, significantly more deadly than COVID, but because of the nature of how they were spread, not as many people got them before they died out. And so there's been a lot of work being done around coronavirus vaccines for some time. So there you have that. Vaccine has side effects I don't want to experience. All we can tell you is, yes, there are side effects, and most of us, the vast majority of us who have had the vaccine, while we may have experienced mild side effects, have not had significant. And while there have been some significant side effects reported, and I'll talk about that in a minute, they're at a pretty low rate compared to the potential lethality of getting COVID. So you're always trying to weigh those two things. There may be some risk associated with getting a medication or a vaccine. There's lots of medications that people take for common conditions like heart conditions. You can take a blood thinner, but when you take a blood thinner, you bleed more easily. And if you were to need to have emergency surgery, you could bleed out. But that's a risk that people take because it saves their lives or improves the quality of life. And that's pretty much how medicine is. You're always weighing those risks. And so with a vaccine like this, you're saying, okay, here's the incidence of complications or symptoms or what have you, and how does that compare to the chance that I'd get COVID and get really sick and possibly die? And everyone's got to weigh those risks. I believe the vaccine has a microchip. I've told you guys, my mom believes this. The main thing I would tell you with that is this has a microchip in it, and we all carry it around. And if the government wanted to microchip us, I suppose they could put it in any medicine that currently people are taking. I can't prove that there's no microchip, but that's one reason people give. I believe that powerful elites want to control or kill us. I personally was told this by someone I was in line with at the UPS store. And so I personally don't really understand what the motive would be, but that is one reason people are giving for not being vaccinated. The vaccine is unsafe. It could be harmful to pregnant women or women wanting to become pregnant. This was based on some extrapolation, some individuals who had some training made about the protein that is utilized in the vaccine, and they made an assumption that if that protein, which was similar to a protein associated with the uterus and such, that it possibly could cause a problem. There is no evidence whatsoever that that is the case, but this has persisted, much like other vaccine misinformation has persisted. Even when it's proven wrong, people have a really hard time letting go of misinformation that they believe. And so it's unfortunate. Blood clots have happened. If you'll recall, in particular, the Johnson & Johnson vaccine as well as the AstraZeneca both have a similar foundation for how they were made, and in a very, very small percentage of our population, they can have blood clotting problems. And so this is something we're now aware of. We know there's other vaccines available which haven't had that problem. So for people who are concerned about that, who feel like maybe they fall into that category that could be at higher risk, you have other options. There's other options that don't demonstrate that particular problem. There is some heart issues that they've identified in kids with mRNA vaccines. To date, all of the symptoms have been minor or mild. There have not been no deaths or significant complications with that, but that's something we'll be watching closely. And people have died after getting vaccinated. This gets reported regularly. I saw something this week. We have to be very careful. Remember not to make a causal connection as opposed to a connection that is simply incidental to. So people die all the time. 100% that death will be fully investigated and it will be tracked and trended. And what I mean by that is if they find at any time, even if it's exceedingly rare, that a death could occur, then we will understand better what the basis of that is. But thus far, we're not seeing significant trends that you can easily point to the cause being the vaccine. Some people don't want to be told what to do, and others are just waiting to see. So what I would tell you is, there are many, many reasons why people might choose not to be vaccinated, and you have a right to make your own choice. I just want you to understand that when you're unvaccinated, you are at significantly higher risk of getting COVID, particularly with this Delta variant, which they think with the Delta variant, it's passing much, much more easily between people, maybe even outside of this 6-foot distance, 15 minutes. There's beginning to be signs that perhaps people who are unmasked, just casually interacting with each other, could get COVID. And so, please make an informed decision based on facts. That's all I want you to do. Okay, so I did want to talk about some of the questions I've gotten. One is, what can I do if I just don't want to return to on-site work? I feel it's unsafe and I shouldn't have to if I'm able to get my work done from home. And I really need to emphasize to everyone that we've made every effort to ensure that our workplace has every safeguard recommended. We've looked at the HVAC systems and the filter and the airflow. We've assessed the size of every workspace and room within all of our buildings. We have implemented continued masking for vaccinated and unvaccinated staff in all of our buildings, and visitors and people we serve, because we want to take those extra measures. We will be monitoring symptoms and positive COVID cases diligently so that we can just really constantly assess the effectiveness of the measures we're taking. And we're going to continue with the hybrid work model until we can see that those measures are effective. We'll also monitor local and national trends and respond as needed. So if we were to see all of a sudden a surge in cases in Fresno County, or certainly any sort of surge within our department, we're going to change what we're doing. That's what we've done all along. We've kind of set in motion a few different times, coming back to on-site work, and then we've scaled back when we've seen trends in our community that concerned us. We will continue to do that. But I have to emphasize that we have to put the people first who we serve, and there are tremendous benefits to in-person interaction. We've all really suffered from the lack of socialization that we've had the last year. It does interfere with team buildings. It's very hard for new employees to start and have no connection to work. So orientation and training, we think, can be done better in person. Supervision is done better in person. And some work, it's just easier to accomplish. It's easier to read people's nonverbal cues when you're in person, less chance that you're going to have conflicts. And also, we do still have some technological glitches at times that I've been in meetings throughout the entire pandemic where I lost connection or couldn't get connected, or other people couldn't, or we couldn't hear them, or what have you. And we will look at opportunities for permanent, full-time or part-time or hybrid telework. I've committed to that. I remain committed to that. But we are going to move forward. We won't always make decisions that you all agree with. We have to accept that. But we will make decisions that have taken all of the safety considerations into consideration. Now, even when we get to the point where we have some permanent telework opportunities, I do want to emphasize that doesn't mean you will never, ever, ever come to the office. There could be meetings, again, supervisions, things like that, picking up equipment, doing a training where we will have in-office time. And so I just want to make sure you understand that as we contemplate down the road having these permanent telework positions. And then also, why am I being asked to return to on-site work or attend an on-site meeting when we haven't seen that return to on-site work plan you've been talking about forever, Dewan? Well, we've said this throughout, and I'll emphasize this again. Throughout the entire pandemic, we have brought people back into the on-site work setting as needed for business needs and to meet the needs of the people we serve. And we will continue to do that throughout. That's not contingent upon a plan. We don't have to have a plan produced in order to bring people back. Many of the elements of the plan have already been implemented in the department, and so I feel really comfortable that we're taking all of those safety considerations as we make those decisions. We should have that on-site work plan done pretty soon. I'm going to be honest with you, I just haven't rushed it because we haven't needed to. We're working through some details, we're answering questions, and we'll get it produced and give you guys that heads up as soon as we can. So what else have you heard or want to know more about? I'm going to look over here, and I'll also have my cell phone handy. I've heard I'm healthy, and if I get COVID, I'll be fine. I don't see why I need to be vaccinated against something that is not likely to be harmful to me. Well, I will tell you, there's also some people who've had COVID, including people in my family who said, I've had COVID, I have the antibodies, I don't need to get the vaccine, I don't want to take that risk. And we're hearing people who are getting COVID a second and third time and getting hospitalized when they were not hospitalized previously. So you're playing Russian roulette, you're rolling the dice, you're taking a gamble. Again, everyone has to make those decisions for themselves. It's just, you should be basing that on facts. And with a highly increased risk of getting COVID, a heightened risk of being hospitalized or possibly dying, make sure you take that into consideration when you make that decision. And then how much of it is pride? We are definitely seeing in our society people with tightly held beliefs. And what I mean by this is it's very, very difficult to change anyone's opinion about anything right now. And when I say opinion, I mean truly opinion. A lot of opinions are not based in facts. A lot of opinions aren't based in science, but once people have developed an opinion and have bought into it, it is very difficult to change people's minds. So what I try and do, and what I encourage you to try and do, is just ask questions. Wow, why do you feel that way? And what information have you read or heard about? What was the source of that information? And does that seem like a trustworthy source? But be open and curious. That's really the best way to interact with people who have tightly held beliefs, who really don't, interpret every new piece of information in a way that's biased towards what they believe. We call it confirmation bias, which means you and I can say, read the same headline or news article or go online and find something, and I read it one way and you read it the other, and we both interpret it based on our own set of beliefs. And that's partly human nature and partly just where we're at as society, that people don't really seem open to having their opinion or beliefs challenged, and when they get new information, they interpret it through the lens of what they already believe. They're not looking for their mind to be changed. They're not testing their assumptions. They're not curious about what else might be out there that could provide them with more information to make a better decision. And all of us are guilty about it at times. Sometimes, though, having those types of rigidly held beliefs can, put you at higher risk. And in this situation, that's really my concern. Getting vaccinated can help protect people around you who cannot get vaccinated or who are not as privileged with their physical health. Absolutely. That's the whole point of herd immunity. Right now, we have a large percentage of our population in Fresno who are younger than 12, for whom the vaccine is simply not available. Maybe they have underlying health conditions. The deaths we've had in Fresno County of kids younger than 18 all had underlying health conditions. And so those are people who don't have the privilege to be vaccinated, who don't have the opportunity to protect their own health with choices they make. They're relying on the rest of us to make the choices that protect their health. And I understand that sometimes when we're making choices for ourselves, we don't feel like we should have to consider other people. That's human nature as well. But it is an important point to make that not everyone has the opportunity to have the privilege to get the vaccine. And when we don't get vaccinated, it puts them at a disadvantage as well. Okay. There was also a question about trying to prevent the spread of any flu cold to my coworkers, regardless of whether or not I have symptoms. I'm not sure exactly what this was about, and I apologize. I don't recall the exact question, but I can tell you some things I do recall, which maybe were that question, but I just don't remember it exactly. By continuing to wear masks, we will protect each other from all kinds of viruses and bacteria that we might be spreading respiratory-wise. And washing our hands and, keeping that distance are all things, cleaning our surfaces, that type of thing. All of those are just generally good hygiene that can protect each other from all kinds of colds and flu and other viruses that might be out there. So it is definitely good practice to not come to work sick and to practice all of those good infection control measures, including wearing your mask. We are working on how we can support people if they do get a positive COVID test or do have symptoms but are able to continue working in terms of being able to perhaps work from home during that period of time. Even if we brought you back to on-site work, we're looking at that and hope to have something pretty soon about that so that we can support people to make good decisions and not feel like they won't be able to work just because they have a positive COVID test, for instance. All right, I don't see a question there. Let's see, okay. Of those that are getting tested now and testing positive for COVID, is there any known fact if the people testing positive are vaccinated or not? I shared some statistics with you in terms of hospitalization and death. I'm gonna go back to that slide. And I don't have the statistics right in front of me. I shared last week that because we know that even the most effective vaccines, right now those are the mRNA vaccines, Pfizer and Moderna, which is mostly what those of us who were vaccinated within our department received, most of us, those have the highest effectiveness. All of the vaccines are at least slightly less effective with the Delta variant. So the example we gave last week is that there will still always be a percentage of people who are vaccinated who get COVID. One thing I heard this morning or yesterday on public radio was that they are looking at the test results, so the specimen that we take when we get that nasal pharyngeal swab. And what they're finding is people who are vaccinated have far less COVID virus in that specimen than people who are unvaccinated, as much as like 1,000 or 10,000% more for people who are unvaccinated. So it's a little workhorse, this Delta variant. It's just producing virus like crazy. And if you're unvaccinated, you're likely to spread the virus much, much more than someone who's vaccinated. That's why we're all wearing masks, because we want to have that extra set of protection. And so people are still getting COVID who've been vaccinated. That we've known all along that was a possibility, but they're just not getting hospitalized or dying as much, and they're not getting COVID as much. So I'll give you that quick example again. If we have something like 80% of the population who has been vaccinated, and they're vaccinated with something that is 85% effective, then if 100 people are in a room and 80% of them are vaccinated, that means 80, and 20 are not, then roughly 17 of the people in the room who were vaccinated will get COVID, and 20 of the people who were not vaccinated will get COVID. And so you're still going to have a large percentage of those people getting COVID have been vaccinated, but a much higher number of people who don't get COVID who are vaccinated. I know this sounds kind of confusing, and so send me an email if you want a better explanation. I don't have that slide in front of me. But basically, the more people that get vaccinated, even with that small percentage of people who are vaccinated who get COVID, you'll have a larger absolute number of people who get COVID. So that's why even though we've been vaccinated, we wear our masks, we still keep that distance and follow all of those precautions because we can still get COVID. Less likely to pass it to people, less likely to have bad complications from it, but we can get COVID. Are we going to have on-site testing? We are working on on-site testing. There are some newer or faster turnaround times and such, and so right now the testing that's done in the community is much faster turnaround because there's not as much testing being done. So the turnaround time for the labs is much quicker than it used to be. But we will make sure that we have convenient and easy testing to do in order to make it convenient for staff to get tested. All right. Any other questions? Looking at my handy dandy support Brian over there. All right. There is no question I will not attempt to answer or find an answer to. I am prepared that talking about getting vaccinated may make some of you uncomfortable, and while I'm sorry that you're uncomfortable, I feel that it's really important that you make the best decision for you based on the facts. And I want you to understand you are at higher risk if you remain unvaccinated, and you are putting other people at risk by remaining unvaccinated. So please consider all the facts and make the best decision for you. And I wish you all the best. Everybody have a great weekend, and we will see you next week.